right. So once again, welcome to this community of practice in building a culture for evidence kickoff meeting. My name is Romeo Altassin, and I am the research associate at APHSA. So since I joined the organization, one of my biggest priority has been to fill the gap between policy and research, and also help human service agency increase the capacity in using evidence and data. And over the last few months, I've been working with Matt to establish a community of practice which will provide a learning space for evidence leaders like all of you, to translate research into policy, and also use this community of practice to develop some strategy to harness the use of research and data. So I'm really pleased to be launching this effort, and I hope that it will bring some value to your work. I would also like to inform you that Amy Gilbert has agreed to serve as a chair for this community of practice, and we are very happy for that. And I would like to give her, Amy, would you like to say a few words to the group?
I'd be happy to. I have no prepared words except to say that I've been with Indiana Family and Social Services Administration for, well, what feels like a very long time, but as in actuality about a year and a half, but it's certainly been a very eventful year and a half. And during that time, I've had the pleasure of getting to know these folks at APHSA, and I'm really excited about this. We've had some earlier conversations about the importance of having a community of practice, really building out and providing peer support to one another as we try to make our practices, our policies reflect what we are seeing in our data and in the evidence more broadly. Just really delighted to have this opportunity to meet with you all and be a part of this group. So thank you for the opportunity, Matt and Romuald, and I look forward to meeting you all and doing some good work together.
Thank you so much, Amy, for your leadership with this effort. So I would like to turn it over to Matt to kick us off with today's agenda. Matt, back to you.
Thanks, Romeo. Why don't we go ahead and if you can move us to the next slide. And for those of you who I've not met, my name is Matt. I am the Director for Policy and Research here at APHSA. So my world kind of spans both with supporting Romuald and advancing our research portfolio that we dive deeper into subject matters that are of interest to our members, but also in leading our policy agenda as an organization. And I think that this group really stands at the kind of precipice of those two things. And I'm excited to very much learn from you all, and we'll be tag teaming with Romuald and providing some support to this community. We have a lot of ground to cover today, so we are going to do our best to make sure we get through things quickly so we can divert as much time as possible to hearing from you all. This is really kind of our level setting meeting to understand how we kind of set forth a path for the upcoming year to have dialogue that will be helpful and relevant to advancing your work. So we'll spend a little bit of time just getting to know each other. We all come with slightly different hats and slightly different vantage points, and we want to kind of hear from each of you. We'll do a quick little, hopefully not painful icebreaker to get to know each other. We'll give you a little bit of background and context for some of APHSA's more strategic work that we're hoping to lay the tracks for in this next year to kind of really advance the culture of evidence around human services and leaning into this, kind of recognizing the increasing importance of evidence use and driving federal policy making and the work that's happening at the state and local level. We'll walk through some of the survey results that you all told us for what you want to see this group be. And then we'll kind of talk some initial thoughts around a meeting structure for facilitating conversation, and then hopefully spend most of the time today hearing from you about kind of refining that strategy and talking about next steps. So with that, why don't we go ahead to the next slide. So we're gonna start with a little icebreaker. We'll take a little bit of time. I think one of the things that's unique about this group, this is kind of unlike some of our other communities and affinity groups that we manage, where folks are clearly in a lane of a SNAP program or childcare or some portfolio. The lines are a little bit fast and loose when it comes to evidence building, and are adaptive to kind of what your agency covers and how you have operationalized this kind of role of use of evidence use. So we want to hear from you all just to quickly understand who you are, the organization you're with. We all have different titles, so I'd love to hear your title, and then maybe if everyone could just share maybe something that you've done or your organization has done around evidence use that you're particularly excited about and looking forward to sharing potentially with the group, and perhaps something that you're hoping to learn from others in the group as an area that you want to work on within your agency for the upcoming year. And I'm going to go by the boxes that I see on my screen in order. I promise I'm not picking on anyone. And it looks like I see Jerry from Solano County. I see a lovely binder in the picture. Jerry, are you there as well?
Yes. Can you hear me, Matt?
I can.
Okay, good. Well, welcome everybody. I'm Jerry Huber. I'm the Director of Health and Social Services here in Solano County. To give you kind of a idea where Solano is, we're literally halfway between San Francisco and Sacramento in the northern tier of California. We have a population of about 440,000, and basically we're an integrated department in California. It's called a super agency. We do everything from eligibility, social services programs, public health, huge presence in behavioral health, as well as something a little bit different in California, where we don't have county hospitals in our county, but we have a huge presence in doing primary care. So we do a little bit of everything. Just want to, our recent claim to fame, because we have Travis Air Force Base here, we had the repatriation from Wuhan of American citizens back in February. So we were kind of thrown into COVID right from the very beginning. Several weeks after that, we had the first community spread case in the country of COVID. And just in the last couple of weeks, we had the first case confirmed of co-infection of influenza and COVID. We always wonder, okay, why do we have to be the first on all these things? But I think when you talk about evidence-based practice, we have learned a lot associated with public health aspects of COVID, as well as many other aspects of public health in terms of protecting the community. I've been in health and human services for 30 years, feels like 40 years, and primarily in county government, but I was with Governor Cuomo for 4.5 years and stayed in New York before coming to California. Also, last thing I will just indicate, for evidence-based practice and child welfare, always been interested in that, and I serve on the advisory committee with the University of California, San Diego on evidence-based practice in child welfare.
Thanks, Jerry. I hear that there's something going on with evidence use in child welfare lately. Plenty to talk about on that front. So we're glad to have you, and appreciate all your background and knowledge you bring in to this group.
Thank you.
Amy, you're up next.
Well, hi again. So my name is Amy Gilbert. I'm with Indiana FSSA. I don't think I mentioned before, I'm the Chief Science Officer with our agency. We are not an integrated agency. We are focused on human and social services, the typical Medicaid, SNAP, TANF, and a host of others. We do, however, work very closely with our Indiana State Department of Health, and certainly in COVID and throughout the pandemic, we've worked incredibly closely with them. And as far as something I'm very proud of, we have really taken an sort of an evidence-based approach to our COVID response within the state. And we have a state university partnership that we've been relying on heavily to help supply us with the evidence that is not generated from our own data. So more broadly, a group of librarians and academics that we're working with very closely who are pulling together answers to key questions that state leadership has, both in the ISDH and also the governor's office and beyond. It's also really informed, again, external evidence as well as our own data, and a really phenomenal data team that has been and working with that really has informed the decisions we've made around reopening, mitigation measures, et cetera, et cetera. So I have lots of interesting stories about that, but I really am pleased. When I say that the last year and a half has seemed like at least 5, I think it's just accomplished so much in such a short period of time, including relationship building with other agencies across the state. So yeah, I think you had a second question that I don't think I hit on. What do I hope to gain from this? Yes.
Got it.
I am just really interested in learning about how other agencies operate, some of your areas of focus, how you make evidence to policy actionable in your state. I just feel we have a lot to learn from others and hope that we have some lessons to share as well.
Thanks, Amy. All right, let's keep going. I see Dave from New York State.
Hi, everybody. My name is Dave Nicolecki. I'm the Director of Data Management and Analysis for the Office of Temporary and Disability Assistance in the state of New York. We're kind of a broad-based social services agency. So we're the state TANF agency. We cover SNAP, child support, HEAP, refugee services, welfare to work programs, and a few other things like that. That's just to kind of name a few. We've been at this for quite a long time here, and I've been in this office for a long time. The Office of Data Management and Analysis is kind of like a central office, you know, that does ad hoc reporting, program evaluation, data analytics, that sort of thing, and works with our IT folks, which is a separate agency in New York State, to develop the infrastructure to do the stuff that we need to do. We are about to embark on a development project to replace our eligibility system in the state. And the idea is that we would be integrating all these programs into one new data system and develop the back-end data infrastructure to help us do the kind of things that we want to do in the future, have always wanted to do in the past. So this is kind of like a great time to be involved in a group like this. And I'm very much interested in, you know, kind of like the infrastructure development that people have done, software choices that they may have made, you know, especially in terms of, AI and also data visualization. And yeah, it's super timely for us, and we're really glad to be a part of it.
Great. Sounds like lots of interesting work to come, Dave. All right. Next, I see Nicole from New Haven.
Hi, good afternoon, everybody. Nice to be on the call. I saw the chat come in from about upstate New York. I have unfortunately, no connection to Offord, upstate New York, unless you count living on 98th Street in Manhattan as upstate New York, which some people do. I no longer live there, but I did my medical school in New York at Mount Sinai, and then residency in NYU. Took a path through research at Yale for a couple of years. Went through a research training program and then ended up in public health after that. So for the past 11 years or so, I've been in the public service field, most of that directly in public health. Spent some time with the New York City Health Department early on, then spent 7 years as the state chronic disease director in Connecticut. And I am currently the community services administrator for the city of New Haven, overseeing our health and human services programs. So that's my background. I think from the question around evidence, for me, the most interesting part of evidence is the concept of distilling and applying what the best sort of core aspects of evidence are and adapting them to local context. I've spent many years looking at evidence-based programs, and sometimes if you're very doctrinaire about how they're applied, it doesn't quite fit for the context and it's not going to work. So my interest in it is in adaptability of evidence and understanding core elements that make evidence-based practices successful. I think in terms of a specific program I'm really excited about standing up is we're looking to stand up a mobile crisis team, which would diversify our ability to respond to calls that come into our 911 dispatch center. We have the traditional fire, police, and EMS response, but now we're looking to stand up a team that would respond to mental health crises, homelessness issues, substance use disorder. So we've been doing extensive surveillance of the evidence, surveying of the evidence that exists for these programs. And again, this question around how to adapt to local context is always looming large. So excited to participate in the group. Thanks.
Awesome. That sounds like really interesting stuff. I'm looking forward to hearing more. So moving next down, I see Michael Beckett. I see Michael from Fairfax. Michael, if you're able to share a little bit about yourself,
sure.
Anything that you're excited about from your agency and what you're hoping to learn from others.
Sure. I'm Michael Beckett. I'm the director for the Department of Family Services for Fairfax County in Virginia. It's the largest social services delivery system in the state of Virginia outside of state government. I've only been here for about a year, a little bit more than a year. I was actually Assistant Secretary for Human Services in the state of Virginia, and before that, the Director of Social Services in Durham County in North Carolina. I think, this is a really exciting time, I think, for a lot of us to make some fundamental changes in our service delivery systems as we're learning how COVID has impacted how we are able to really do things remotely. And right now in Fairfax, one of the things that we're doing is that we are teaming up with Accenture to implement a practice model in child welfare, and really wanting to center sort of all things related to the social services, the child welfare delivery system on that practice model, and really wanting to, and we're actually looking for a research partner to evaluate sort of our outcomes against how this particular practice model has been used in other places. I think what I'm interested in learning is really about data sharing and how different jurisdictions across the nation have gotten over sort of data sharing, where so many of our sort of clients in common access multiple systems, and what are some of the fundamental questions we have about how we serve people better when data is in so many different forms and different systems. And I know from my work in North Carolina in Region 8, the federal government, I do know that Region 8 was looking at sort of breaking down some of the silos. I don't know how far they've gotten, but it was actually fascinating to be in a room with CMS, the Department of Labor, the USDA, the Administration for Children and Families, all talking about the barriers of data sharing and effectively delivering services better.
Awesome. Thanks, Michael.
Sure.
All right. I see Gerald up next.
Is I did it before Jerry, unless there's another Gerald, sorry.
Got it. Thanks, Jerry. All right, then we'll keep going. I see Leon from New Jersey. Leon, are you there? You're on mute right now.
Okay, I'm here. I'm just having little technical issues, but yeah. Again, my name is Leon Crawford, and like you said, I'm with the state of New Jersey. I'm actually with the unit that's responsible. And actually, before I go there, a lot of what Dave was saying is what we're trying, or what I belong to. I belong to a unit that's called the Implementation Team Office, and we're within. I'm under the Department of Human Services, but particularly New Jersey Medicaid, or the Division of Medical Assistance and Health Services. And my unit, we're actually responsible for bringing all our sister agencies together and their systems, and trying to integrate them into one system. And I'm sure you guys can understand that's a major task, and we're not there yet. And so that's why I'm here. I'm hoping to gain some ideas to take back to my managerial leads, and hopefully we'll be able to move forward in the very near future.
Well, great. We're glad to have you. All right. Well, we're moving right along. I'm going to ask Kirsten to go next.
Hi, this is Kirsten Kolb. Excuse me. And I'll turn my camera on full time. I'm just finishing up some lunch here. I am with the Oregon Department of Human Services, so taking it to the other side of the country. And I work in the Office of Reporting, Research, Analytics, and Implementation. And I would say some of the things that we're doing currently in Oregon is we are working on a fairly comprehensive and integrated data warehouse. So we serve 5 areas or 5 programs, which includes child welfare, self-sufficiency programs, aging and people with disabilities, intellectual and developmental disabilities, and vocational rehab. And so we are really working on a data warehouse to bring all of those agencies' data together. We're also working on some data-informed tools to support practice and research-informed decision-making. Also the development and some research questions around a statewide longitudinal data set. We also do some enterprise-wide research. So right now we're partnering with the Oregon Department of Education and using some data-informed tools to help identify high school graduation, which also is a high priority for many agencies, as well as some of our commissioners. And then we also support efforts such as kind of some ad hoc things. So all things COVID, our department ended up being responsible for estimating PPE for our state for pretty much all populations minus the hospitals. And then also supporting things out of the governor's office, such as the Racial Justice Council. So we kind of end up having our hands in many different pots. And today I've also included my colleague, Cody Kaysen, who is on this call and will be partnering with me on this, as I'll be going on leave for a couple of months. But in Oregon, we're super excited about this collaboration. We're really excited to partner with some other states and get some great ideas. And so I'm hoping that between Cody and myself, and potentially maybe including one other person down the road, we can stay really invested in this process. So thank you for the invite.
Terrific. Well, we're glad to have both you and Cody. All right, we got a couple more folks. So next I see Julie from Nevada. Julie, love to hear from you.
Sure. Hi, I'm Julie Balderson from Nevada State Division of Welfare and Supportive Services. So we're the state agency that's responsible for administering SNAP, TANF, Medicaid eligibility, but not the provider side. That's a sister agency. We also have the LIHEAP Energy Assistance Program, the Child Care and Development Fund, and the State Child Support Enforcement Program. So I'm a public information officer. And the big issue is when we start to see these movements toward a lot of the same things all of you are talking about, whether it's data sharing between different systems or it's adapting our policy to a more evidence-based context. I also am a legislative liaison. We have a few within Health and Human Services. My concern and my interest really is, how are you guys talking about this? Can I pick up some little gems here and there on communicating this to people who aren't quite so entrenched in it? And it goes, whether it's internal or external, it's how do staff who don't talk about this stuff daily not relegate it to, oh, that's a different unit, that's a different division, they do that over there, and to kind of bring that into daily vocabulary. And then also how I frame messaging, whether it's doing a press release or some kind of legislative analysis, whatever the case may be, how we can apply those frames in the same direction. So that's what I'm hoping to learn. And the thing I would say for Nevada anyway that I'm pretty excited about isn't actually in my division, it's with our director's office. They've pulled together a team for data analytics, and a big piece of that is previous years. If someone like a state legislator were to call and say, hey, how many people do you have on SNAP? Depending on who you called, you might have different answers. And it all just comes down to how folks are counting and what time of the year you ask them and whether they're looking at projections or actuals. So this team that we have pulled together in Nevada is super exciting, so that we can try to keep folks at least looking at the same set of information and communicating that same pieces of information. So thanks for including me.
We're so glad to have your perspective. I think it's terrific to have you engaged in this group. And then looks like last but not least, I see Rick from Utah. Rick, are you there? Oh, Rick, it looks like you're still on. We still can't hear you.
Can you hear me now?
Perfect. Gotcha. Loud and clear.
Excellent. Sorry about that. Yeah, it's again, you just when you think you've got the technology figured out. So I'm the director of the Management Information Center at the Utah Department of Human Services. What that really means is that we're sort of a data analytics team, somewhat what Julie was describing that group, I think, in her state of Nevada. So I manage DHS wide reporting analysis and quality measures. I've been in this area of expertise for about 25 years. I recently joined Human Services from our governor's office, where I was responsible for statewide performance measurement across many agencies. And so that's given me a focus on operational improvements and data analytics across a wide variety of programs. But our director, who's a cabinet member, invited me to come and to work with them in Human Services, and I'm thrilled to be in this area. It's an exciting time to be involved in working with social services and programs and other things. Just some of the areas that we've been working in and that I have an interest in particular relates to, and others have mentioned, data integration and warehousing. We currently have a fairly robust warehouse. Our agency handles child welfare, juvenile justice, services to people with disabilities, mental health, substance use disorders, aging services, child support enforcement. Those are sort of the core programs, and we've been able to establish data integration with most of those. There are a few exceptions, but we also reach out and partner with other agencies in the state, including our K-12 data at education, the public assistance data, which is not administered, interestingly, in Human Services in Utah. It's administered in our workforce agency. And so the TANF data, the SNAP data, Medicaid, again, eligibility data for those programs, and corrections, adult corrections, as we see some transition especially in juvenile justices between the youth and the adult systems. So those are sort of the primary areas where my team and I work. Our interest in evidence is in a number of assignments that we've received recently about making sure, the question that we get asked a lot, and this does relate somewhat to the Family First Prevention Services Act, but the question we're asked is, well, how can we apply and ensure that the criteria, for example, of the various clearinghouses will satisfy the requirements that the feds have so that we can be reimbursed, for example, for certain programs, or how do we know which programs we can implement and then declare with a set of objective criteria that these are in fact evidence-based. Our experience is that social services is an area with a lot of research, but the rigor of some of that research sometimes leaves us wondering whether it will meet the standards that are in some of the clearinghouse, some of the various clearinghouses. Anyway, my interest is in learning as much as I can from all of you and from the resources that we'll collectively share. So thanks for having me, and that's a little about me.
Thanks, Rick. I think I got everyone. Is there anybody on the call that I missed? Okay. Well, we are so thrilled to have so many different voices. I think all kind of with a collective interest, but coming at it from lots of different angles. So we're really excited for where this conversation can go. And we're going to kind of go through a lightning, kind of some background materials to then kind of pivot to some conversation about where we go next as a group to start diving into some of the topics that are of most importance to you all. So I'm not going to go into detail about who APHSA is. I think you all are here. You probably know a little bit about us. This is what we do. Our job is to bring you all together and help to create these connections so that you all can advance your work. If we jump to the next slide, I do want to just say at a high level, without going into too much detail, we have, every year we go through strategic planning to kind of identify key areas of focus that we see are emerging within our membership and that we hear from you all that we want to prioritize in the learning agenda as well as the policy agenda. And what we've seen and heard in 2020 and what we are hearing for 2021 and beyond too is more conversations and dialogue around building out and leaning into the conversation on increasing evidence of what works and understanding all the different dimensions of that and how do we operationalize evidence in a way that supports the outcomes that are at the kind of core mission of our membership. And that's kind of driving our focus and commitment to advancing these types of conversations. If we go to the next slide. We are kind of trying to operationalize some discussions that really kind of look to span the whole spectrum of kind of building a culture of evidence. So kind of from the point of how agencies are collecting and making use of their own administrative data to how they are generating evidence with that data in partnership with their own research teams and outside stakeholders and bringing in external data sets to combine with that. And then as that evidence gets generated, how is it being translated into policy? And we're really trying to look to develop some content and conversations that span across all three of these aspects, knowing that the discussion oftentimes never fits in neatly into one little bucket, but cuts across all three. If we go to the next slide, we have started to kind of move this conversation forward. So Christina, who's on the call right now, and for a number of you all have also participated in a community that we've already stood up of chief data officers that was stood up earlier this year, has taken off and offered a good forum for kind of really focused conversations around data management, data governance, analytic tools, which very much are relevant and kind of within that Venn diagram of conversations that we anticipate having through this group. And we're going to talk a little bit about how these communities oftentimes the lines are going to be blurry, and we think that that's okay. And in fact, there's going to be lots of opportunities to bridge across multiple communities when having conversations that are relevant to both. And if we go to the next slide, and thinking about specifically this community practice around building a culture of evidence, we want to really kind of amp up conversations that are also happening in those other two kind of circles in that building a culture of evidence. So the discussions around generating evidence and translating that evidence into policy, and that's really been the kind of core part of our efforts to launch this, and where we're hoping to advance conversation in accordance with what we hear from you all for what's going to be most relevant to you all. So with these conversations, a real focus around peer exchange, knowing that the best way of learning is for you all to connect with each other. Where it's helpful and effective, we will look to identify tools, strategies, or platforms to help advance some of the work and lift up some of the work that we hear from you all. We'll look to create some connections where helpful with external researchers and others in the human services community that would be useful in advancing policy conversations that this group is interested in. And we're also heard loud and clear about the interest in integrating equity into the data analytics, research, and evaluation work that you all are leading within your agencies. So let's go ahead, move to the next slide. I won't take time going through this. We've done some thinking about where we can help best add value, and we really think that both this community of you all as kind of what we see as oftentimes evidence champions within state and local agencies, and creating a space where you can identify with your peers and kind of hone your work and learn from each other is important. In addition to lifting that up for kind of more broadly increasing evidence literacy within the human services fields, within your teams and the divisions that you work in partnership with, or your staff that you engage with, identifying some of the content and conversations that will help bridge their ability to internalize the evidence use work in their own activities too. Next slide. We're gonna, real quick before we kind of switch to the discussion phase of the conversation, I'm gonna ask Romeo to keep this to 5 minutes so we can have some time for discussion. We're going to quickly kind of walk through the survey results that we heard from you all, just to kind of get us grounded, and then we're going to talk about what we're actually going to do as a group for 2021. So take it away, Romeo.
Thank you so much, Matt, for this nice overview of this community of practice. So I would like to share with you some of the survey results, and thank you so much for your input. I think they have been really helpful in helping us develop this community of practice. So this first slide here just shows the typology of agencies. So we have a very nice diversity of state and local and city leaders. This next slide here just look at some of the policy area. And the good thing about this group is that there's also a good diversity in terms of area of expertise. So we have folks from Medicaid, child welfare, STAR TANF, SNAP, childcare. There's also some additional area of expertise that might be helpful for this group that include public health, behavioral health, housing, two-gen approach, and so forth. This next slide here looks at some of the expectation that the group has in terms of what will be most helpful to them. So the good news is that there's really high interest across all those 6 sections. So there's really a high interest in hearing from state and other local agency on best practices. And that also include discussing strategy to integrate race equity. And at APHSA, race equity has been at the forefront of our strategy playbook. And there's also high interest in hearing from researcher and academics. So Matt and I have been talking with some academic researcher, and we see some opportunity for us, to collaborate on those evidence-based practice. And this next slide here looks at the community of practice preference. So it seems like the group is eager, to have an open community of practice that include inviting a federal and academic research partner to attend meetings. So I'll be really interesting to discuss some of the content that might be useful for a close audience like now, and also some content for a broader audience that might include some federal research partner like OPRE and so forth. This slide here looks at our communication strategies. So we had, two approaches: either communicate through a group email or communicate through an online community. And it seems like this group is eager, to use the online community as our communication platform. This next slide here, so we asked you guys to provide some interest or success story that you would like to share. So there was some interesting intake here, regarding data integration between child welfare and healthcare, and also the role that the high-level leadership plays in fostering a culture of evidence. So for those who have shared some interest story, they are also provided some specific description of their work. So this slide just captures some of those interesting work that is taking place. So there's some area to discuss around family first implementation. There's also some specific some specific work around developing longitudinal data set to integrate programs. And this slide here just capture your involvement in any APHSA or other group. So it seems like some of you are also involved with other APHSA practices like ISM, or our data analytic groups. Some of you are also engaged with our local council and our communication and outreach community. We also have some relationship with NARS, so it was good to hear that some of you are also engaged with NARS. And lastly, these are just a slide that captures some final thought of the group. So I think it was very interesting for people to highlight how they expect this community to be a very good space for peer learning. Given the pandemic, the resources have been very limited. So having a strong foundation on how to build the capacity to integrate research into policy, will be useful to the group. I think that's it. So I will turn it over to Matt to walk us through some of the structure for the community of practice. Matt, back to you.
Thanks, and thanks for really thoroughly and quickly getting through a lot of that content. We appreciate everybody's feedback. Some initial thoughts on how we could go about structuring these conversations going forward. So let's move to the next slide. I think we're thinking about these discussions at kind of in two different levels. So one is kind of more broadly, kind of what are the needs of the kind of broader human services community around kind of building out their evidence muscle, and understanding from this group, like what type of content can APHSA help to produce and to tap into through you all and others to educate human services members and kind of build out your support teams and other units around their evidence building capacities. And then how this group really hones in as those champions of leading these evidence conversations and learning from each other and thinking about more kind of strategy about how do you build out an infrastructure for evidence use within your agency, and what's the best way to foster those conversations that will work best for you all. So next slide. For that kind of more broader engagement, I think we have already started to look at identifying the type of content that would be helpful, although we hope to kind of draw from what we hear from you all in your conversations to help inform some of that. We want to be able to cut across all the different places of human services and look to be able to draw again from folks within this work that have promising models that would be informative to others, but also research partners that can continue to drive an evidence-focused discussion of economic supports and child well-being and mental health services and public health services, et cetera. But if we go to the next slide, I really want to kind of focus in and then turn over for discussion what we do with these meetings, because this is ultimately for you all, how we have a conversation that's meaningful and advancing your work. So we know we want to have some type of peer exchange between you all as agency leaders in this area around building out your capacity for generating evidence use and applying that into policymaking. Our thought is, knowing you all come from different places and you all have slightly different areas of expertise, we see the work that you do as a discipline really about how do you actually generate evidence and use it within your organization. Like that practice is something that is easier said than done, and learning kind of the secret sauce of what's worked well and what's been a challenge for you all will be really helpful in thinking through opportunities and some next steps for testing and of new opportunities for your agencies. We'll look based off of what we hear from you to bring in strategic partners into specific conversations that might be helpful for you all, as well as the possibility of bringing in discussion on kind of federal policies that look at evidence frameworks. There's been a lot of work obviously in child welfare, but increasingly, and with Medicaid as well, but increasingly with economic supports too, around increasing kind of decision-making around evidence use as well, and that's an area of opportunity. And of course, equity, as Romeo mentioned, is a area of interest as well that we heard clearly from you all. And with that, I really want to kind of turn over to you all. I know it's just been a lot of content we've covered fast. We go to the next slide to have some discussion. And if you go to the next slide, we've got some questions up there just to help stimulate any thoughts. But we want to know what would be helpful for you all for these meetings, the type of content that you're interested in hearing from each other, if there's specific topics that we should be talking about first. Like the format that would be most conducive for you. If you like more informal, just like let's have a unstructured conversation versus having some prepared content for these discussions, or other elements. But given we have about 10 minutes left, I want to kind of turn it over to you all, hear from you on how we can make this a environment that's conducive for you all and provides value to the work of you and your teams.
It's very quiet.
One question I have, this is Rick. Are we looking to have a product at the end of a year or something that can be shared with partners in this space? I'm not sure. I mean, it's wonderful and great for us to get together and to share ideas and to have an exchange and a discussion. But I'm wondering what comes out of this that can be lasting and something we can share with peers in our own jurisdictions as well as with partners elsewhere.
That's interesting. That makes me wonder if we're talking about both the research roundtables and these meetings. And here you've proposed, do we want to have people present during these meetings followed by conversation? Different ways that we capture that information, because I don't think it's one product coming out of this that I personally would like to share. I imagine, depending on how we decide to move forward with this, there might be a lot of things. Whether that might be material that's presented out or through the course of our conversations, if we decide we'd like to collaborate and work on. I could see how we could move one thing if we all agreed on one area that we'd like to move forward, collaborate and think about something that would be a useful tool for everybody. But I don't think I'm adding much here. I'm just playing off of what you just said. I think there would be, I would like to walk away from these meetings in general with materials that I can share with others as well.
I think it's helpful, Matt. I think it's helpful for me to understand what the end result is supposed to be for this gathering. You know, if I'm thinking sort of like with the end in mind, then I can sort of help plot a pathway forward. But it's hard for me to sort of consider what should be in the mix without understanding like who my audience is.
So it's a great point. I mean, I think so. There's a couple different things that we're hopeful we'll be able to take away from these conversations. So one is, I mean, this should be an opportunity for folks that are really at the kind of front edge of kind of fine-tuning their own organizations to be better at utilizing data and evidence within their programs, to be able to talk shop with each other and just be able to understand what others that are in this kind of also going down that path are doing and how that might help inform their work. So having that space for you all to learn from each other is, I think, probably primary for me, something that we want to do. And then out of that, we are really hoping between myself and Romuald to be able to identify those broader learnings that we can take back to the human services field. So where are there things that we can be developing, kind of pulling from you all as leaders, case studies, best practices, models that we can share and disseminate with others? Where does that tie into federal policy conversations when we're talking about use of evidence clearinghouses? Like, what are the important issues and considerations around how you structure that in a way that actually works in practice for folks like you all that are kind of responsible for utilizing evidence and then kind of and making it result into better outcomes for families you serve. So I'm kind of covering a lot of ground there, but I do think it starts by creating a space that's most helpful for you all to dig into like the real nitty gritty of like how do you build out your own systems of evidence use in a way that's like sustainable, systematic, and works effectively. And then from there, we want to be able to deploy that in ways to inform the broader field.
Matt, this is Jerry. I wonder if I could add, one of the things that I'm concerned about for years is that I think I know pretty much the evidence-based models that are in different fields. The thing I struggle with, having been in 4 states, been in state government, been in local government, how do you bring evidence-based models to scale? I've seen in a lot of the work that I've done, even in some of the, I was a grant reviewer with the federal government, I always got concerned that the evidence-based models usually originated and were funded with large communities that had the infrastructure, they had researchers, they had planners, they had writers, but the vast majority of counties and the vast majority of cities are small. So is evidence-based only within the context of those areas that have money and resources? Should they be, I think they should be brought to scale. Also across programs, we have evidence-based models in programs in public health, like Healthy Families, Family Nurse Partnership. The problem I have with those programs is that they're so limited and a lot more families come through child welfare. So they come through a different door, get different practices and different outcomes that are not evidence-based, but they represent most of the population that we deal with. So I get to summarize, I just need something, I don't need to know about evidence-based models, but I need to know how to bring it to scale.
I'll jump in. I agree with that sentiment. I think that's really important, how to bring those to scale. And on a related point, I think that always comes up and it was mentioned by some of the previous introductions is the concept of developing data sharing systems between different data silos. I think that's a theme that has come up over and over again over many years. And I don't think anyone's really cracked that nut. So I think that'll be an interesting point of discussion. And perhaps if you identify thinking of the APHSA stuff, if you know of case studies where human service agencies have done this successfully, having the opportunity to discuss those case studies might be an interesting use of time as well.
So to that end, would it be helpful for these conversations for ahead of these meetings to really come in ready to identify some content that and so to your point, I think some case studies or examples of some models that are out there, and to kind of facilitate some dialogue around like your own reflections on how that, like, why that wouldn't work for your own agency, or what challenges that you've had in your ability to kind of interact and engage with folks that are testing out these different models to kind of dig into the scalability and the applicability of these things in different contexts. I saw one.
Hi, this is Dave. I'm in my car now, so I apologize if the signal isn't clear, and I don't even know whether you're hearing me or not.
We hear you.
Yeah. Okay. I agree with that as well. I mean, I think if you have specific examples about what people have done, from your own perspective what barriers there are to doing that sort of thing. And when you see what other people have done, they suggest solutions for you. You can ask them exactly, well, how did you overcome this hurdle? On a more prosaic level, I mean, the kind of things that we could come up with kind of as a lasting list, besides the things that people have done, but overcoming barriers to data sharing on a legal level. So, MOUs that people have developed to solve certain problems, how they've worked within their state law and federal law to do certain data sharing. I think data visualization type software that people have used, the pros and cons of that, the expense of that, how they interface with their data systems. And another thing would be training resources. So as we all know, I mean, this is nascent, but it's a rapidly developing one. And, getting kind of like affordable and usable training for staff in order to, do the technical aspect of this, as well as think through kind of the models. I mean, as was said earlier, I think most of us are pretty familiar with, kind of like how we would build a model, causal model, and all that other stuff. These other kind of hurdles, more practical ones, I think we could, pull something together that people could use kind of as a menu or a guide, when they're developing things.
So this is Amy. It's interesting because as you all have been talking, I think 3 areas that have been of significant, areas of focus for me over the past few months are cross-agency data integration and governance to really allow for cross-agency evidence building to inform policy. And I think I'm hearing that here. I'm also hearing this translate evidence-based models, disseminate and scale up, and almost some use cases, some examples of that in action. And then I think I'm also hearing something about communicating evidence to policymakers, whether that be through visualizing, software to help with visualizing, or otherwise making that happen. Those are some of the trends I hear coming out here that really resonate with me.
Yeah, I think you hit it spot on. I know we're running up on time, and I'm sure that folks have back-to-back schedules, and I want to be respectful of that. So my sense from hearing these conversations, we'll pull folks afterwards, see if anyone has strong opinions. My sense is that we so we want to have a recurrence of these conversations that we're able to go deep, but also know that each of you are incredibly busy. So we might look at something along the lines of like a bi-monthly conversation, getting together around these different themes and kind of use examples for us to dig into different aspects of like these different buckets that Amy, what you were pointing out, I think could all make some really great conversations for us to prepare for some discussion, and for Romeo and I to really think about how do we develop some deliverables or kind of broader learning that would be helpful for the larger field. We will send a follow-up email. Oh, I see Julie adding a comment around a toolkit on how to contextualize, scale, and communicate and engage models. I think that's great. I encourage folks to reach out to Romeo and I if you have additional thoughts, or if there's anything that you're really eager to share that you think would be good to generate some conversation. Even if you don't, if your work is not yet finished, that's okay. I think we're interested in work that is ongoing, and for folks to be able to talk through these things with each other. But we're really excited to dive into this conversation. We think there's a lot to explore, and we're really looking forward to learn from you all, and hopefully be able to use what we learned to advance this work at a much more strategic level too. So I apologize. I know we had to fit a lot in today, and we did our best to get through as much as we could. Is there any other final comments or thoughts before we wrap up for today?
Only that I appreciate you trying to pull us together. I'm excited about the potential.
We appreciate the forum. Thank you.
Yeah, thank you. Yeah, we're really excited. We appreciate you all.
I appreciate it as well. I just want to know, like I said, I'm mid management here, so I'd like to know when the video would be available to share with my management.
Sure. I'll follow up with Romeo. We'll follow up and make sure we get something distributed tomorrow for you, Leon.
Thank you much.
Terrific. All right. Well, take care, everybody, and look forward to continuing the conversation soon.
Thank you.
Thank you, everyone.